In this video, I will discuss the serious consequences of bottle feeding and why it is essential to be aware of the risks before taking such a decision. 1. What are the risks associated with bottle feeding? Bottle feeding carries a number of risks to both mothers and infants. It increases the risk of obesity in children, as formula-fed babies may consume more calories than breastfed babies. Bottle-fed babies can also be more prone to infections and illnesses due to a lack of exposure to protective bacteria found in breast milk. In addition, formula-fed babies tend to have weaker immune systems than their breastfed counterparts. The formula may also be contaminated with bacteria that can cause serious illness or even death in infants, making it essential for parents to prepare bottles correctly and clean them thoroughly after every use. Finally, bottle feeding may lead to an increased risk of ear infections, gastroenteritis, respiratory tract infections, and other diseases in infants. 2. Why is it important to be aware of these risks? Bottle feeding should be a carefully considered choice, as there are numerous risks associated with it. Not only can bottle feeding lead to significant health and developmental issues for your baby, but research has also linked formula feeding to an increased risk of sudden infant death syndrome (SIDS). In addition to the potential physical harm that may occur when babies are not breastfed, there is also evidence suggesting that breastfeeding helps build strong emotional connections between mothers and their children. Breast milk contains hormones such as prolactin and oxytocin, which bond mother and child together emotionally. This connection is important for baby's development. Bottle feeding does not provide these same effects and can make it more difficult for parents to develop close relationships with their babies. 3. How does bottle feeding affect a baby's development? When a baby is not breastfed, they miss out on essential nutrients from the mother's milk that aid in development. For example, breast milk contains protective proteins and antibodies that are beneficial to a baby's immune system and help reduce the risk of infection. Studies have also shown that breastfeeding can positively affect cognitive development, with infants who have been bottle-fed having lower scores in tests of intelligence than their peers who were breastfed. Bottle feeding can also lead to an increase in the likelihood of certain medical conditions, such as obesity, ear infections, and asthma. Furthermore, research suggests that there are long-term health advantages associated with breastfeeding, which include a reduced risk of developing diabetes and some types of cancer in adulthood. 4. Does formula provide adequate nutrition for infants? No. While formula manufacturers have made many improvements in their products, including the addition of important vitamins and minerals, breast milk remains the most complete source of nutrition for infants. Breast milk is packed with antibodies that support a baby's immune system, while the formula does not contain these protective elements. Additionally, studies suggest that breastfed babies may grow into healthier adults than those who were bottle-fed as infants due to the beneficial components found only in the mother's milk. Because of this, doctors and health organizations recommend breastfeeding whenever possible. 5. Can babies become dependent on formula if not breastfed? Yes, babies that are bottle-fed have the potential to become dependent on formula if not breastfeeding. A formula can be viewed as a comfort item for some babies, and this can lead to an over-reliance on formula rather than other forms of nutrition. Additionally, the formula does not contain the same immune system strengthening elements found in breast milk, making it more likely for infants who have been fed only formula to become sick more often and take longer to recover from illnesses. Bottle feeding should always be supplemented with breast milk or alternative sources of nutrition whenever possible, so the infant does not become reliant on formula alone. 6. Are there any long-term health effects of bottle feeding? Yes, there are long-term health effects of bottle feeding. Studies have found that children who were bottle-fed as infants are more prone to developing chronic illnesses such as asthma and diabetes later in life. Bottle-fed babies also have high risks for obesity, dental cavities, and infections of the ear, throat, and lungs compared to breastfed infants. Additionally, bottle feeding can increase the risk of sudden infant death syndrome (SIDS) because artificial milk does not contain antibodies that help protect a baby's immune system. Therefore, It is important to consider all potential long-term consequences when deciding how to feed your baby. If you do choose to bottle feed your baby, be sure to follow safety guidelines carefully. 7. What steps can parents take to ensure their child is receiving the best nutritional care possible without relying on bottles excessively? A good way to ensure that your child is receiving the best nutritional care without relying too much on bottles is to practice a combination of breastfeeding and bottle feeding when necessary. When it comes to breast milk, mothers should try their utmost to meet their baby's needs by breastfeeding exclusively for at least the first 6 months. This provides ideal nutrition, as well as protection from illnesses such as respiratory infection and diarrhea. Mothers who are unable or unwilling to breastfeed can access formula milk that has been designed specifically for infants under 1 year old. Parents should also avoid giving cow's milk before 12 months of age because it does not contain enough nutrients for babies this young. When offering solids, parents should introduce them during the complementary feeding period, which usually begins at around 6 months. In addition, parents should avoid giving their baby honey and sugary drinks such as juice and carbonated beverages, as these can cause serious health issues if consumed in large amounts. We've seen how bottle feeding can have serious consequences for infants, so it's best to avoid the risk and stick with breastfeeding. If you want more information on this topic or other parenting tips, make sure to comment below and subscribe to our channel. Thanks for watching and take care.